I'm very honored to be here with all of you today. And I just want to point out that the Advocacy Bootcamp training is something that we created at TAC because we get contacted by family members and people with mental illness, legislators, people that want to know how to work on it, how to work on improving the mental health care system. But most of the time they come in not knowing where even to start. And that's very time consuming when you're taking these calls and Zoom meetings one by one by one. And I really wanted to create a program so that we could try to begin doing basic training on these SMI issues for a group of people at a time because we need to grow an army. So I'm going to share my screen here. Okay. So I'm going to start by telling you that I label all of my talks that I do personally, advocacy talks, ripples of hope. And there's a couple messages here on this page. One is that almost every one single act of advocacy leads to more, right? You do one talk, you get invited to give another talk. You start working on a bill, you sometimes figure out you need to be supporting other bills. Things lead to more things. And I'm especially happy to be here today with you today because this is a chance to get 40 some people more acting and working in this work. Adding more voices to this work is critically important if we're going to create a social movement to really get the changes we need. The other message here is one of the things I learned early on when I finally got to the family to family class was that you needed to figure out your way of finding your calm. And those ways of finding calm come in a myriad of ways. For some people, that might be reading. For some people, it might be going out and screaming in the woods. I do that regularly. But for me, my sense of calm comes from getting on the water. And the message for all of you who either have a mental illness, you're in healthcare, or you're a family member is that you need to figure out your way of finding a little bit of peace every single day and make that a huge priority. Because if you can have a little bit of peace and calm, you can become so much more effective at what you're doing in terms of caring for your loved one and working in advocacy. So I want to thank Kate for the invitation to come and talk with you today. And I know that this was designed for Colorado. So for people that are attending from other states, please grant me grace that I aim this really at Colorado, but everything that we're teaching you today really does apply to other states as well. Okay, so we started with introductions. The agenda is something we're going to cover, just a brief overview of the day. You all have a agenda that was sent to you in an email a couple days ago from Kate. But housekeeping, some basic things. We're going to ask you to go ahead and keep yourself muted while I'm presenting. But at the end of each session that we cover, there will be time for questions and answers and discussion. If you have questions that come up during the time that I'm talking, feel free to go ahead and write yourself a note or put it in the chat. I think Kate and Robin will be monitoring that chat so we can be sure we try to address the questions at the end. And I am going to ask you to please turn on your cameras if you possibly can during the Q&A, the breakouts and discussions. Because one of the reasons we want to do this is to have everybody be able to meet each other. There's value in getting connection, networking, meeting each other. And it's a lot easier to do that if you have your camera on. Now, I know there may be some circumstances where maybe you just can't do that. And if that's okay, that's fine. We grant you grace for that. Okay. So Kate gave you an introduction to who I am, and she's right, I'm a mom. But I was a physical therapist for 34 years, and I retired in 2019 when I came to recognize that if I wanted to affect the changes that I believe are really needed at the local, state, and national level, I needed a lot more time. So I retired and I became a lobbyist in the Iowa legislature for my husband and I, our organization, Iowa Mental Health Advocacy, which really isn't a big organization like Mad Moms at all. It's mom and pop. We created that when we first went as citizens to the legislature, basically just to have a place to house research that would support the bill that we were asking for that first time. But I am an unpaid lobbyist. I do that, and I'm the only person showing up over there who is really specifically advocating for people with severe mental illness. And I have lots of colleagues. I do serve on the NAMI Iowa board. I did happen to start the first AOT program in Iowa, and I'm currently working to get more of those programs started. And after doing all this volunteer work for a few years, I was recruited to come to work at the Treatment Advocacy Center as their legislative advocacy manager. And I do that on a part time basis because I didn't want to have to feel guilty about keeping up with my Iowa activities while I was also working. It seemed to be a reasonable compromise to try to do both things. So, in that role, I track legislation across the country and in the federal government, and then help to mobilize advocates through emails, advocacy alerts, et cetera, in the respective states to try to get bills passed. I also serve on a lot of boards, work groups, committees, and the National AOT Advisory Board. So to say that I'm immersed in this work is probably an understatement, and we don't have an expectation that all of you will do this. Not at all. But just to let you know, this is something I eat, live, and breathe. Okay, so why? I'm going to share with you my why because I want you to understand that I am one of you. My husband and I have two adult children, and our daughter is quite healthy and happy. I'm happy to tell you, but our son is not. He lives with a very severe schizoaffective disorder. And just like most of our children who develop a SMI, he started out as a bright, smart, funny, happy, caring, incredibly artistic, and athletic little boy whom his little sister just adored, right? But then teenage years came, and initially we thought we were dealing with rebellion, as most of us do when this first comes on. But pretty soon it became apparent that he was pretty sick. And this is a self portrait that he drew that we saw at the time, where you can see the sadness in his expression, but also just the beginnings of some concerning imagery showing up in the background of his artwork. But this self portrait is probably much more reflective of his experience during the early years of his illness, right? And perhaps even today. And it's a picture that we did not see at the time because just like most of our loved ones, when they first get sick, they hide their symptoms at first. He hid this picture from us, and we saw it several years into his illness. And he's been through the churn. He's gone through the revolving door over the past 19 years of all of these hospitalizations, drug rehab, because he also has a co occurring SUD with marijuana, and residential care facilities, group homes, trying to live in our home with community services. And it wasn't until 14 years into his illness that he finally got an extended stay at the state hospital in Independence at what's called the MHI, the Mental Health Institute. He finally was allowed to stay there for long enough to actually get comprehensive multidisciplinary care with regular intervention with a psychologist, a fully structured day, security. They caught him up on his medical, vision, and dental needs, everything. It wasn't until 14 years into his illness that he actually received the level of care that he needed, right? And I share the pictures of the brains below because what I really hope for most audiences to hear is that because we are unable to have somebody go into the hospital and stay there or some other level of care with enough support to actually figure out the right medication cocktail and therapies to help somebody's brain to heal up enough so they can become cognitively aware of their own illness and learn how to manage it for the long run. Because we can't do that, we as a society are causing people's brains to become so much more sick than they have to be. And if I were to think about the basic element of why I'm so obsessed with this, it's this. This isn't how we treat any other medical condition, and we have to change this reality. And for me, the changing thing was the NAMI family class. And I want to state here that I know it's not everything, and I know that there's other classes out there that are doing a better job of training caregivers. Okay. But for me at the time, this was in 2015 that we took the class, it was changing. This is a slide I shared to show what it was like for me before I got to the NAMI family class. Like many families, we were really isolated, right? We had kind of withdrawn into the a crisis of trying to get our son care. And I really identified very closely with this very famous statue of a grieving parent because I felt like an empty shell of myself. Before this, before our son got sick, we hadn't met a problem in life that we couldn't fix by trying harder, by researching, right? No matter what we did, we could fix it. But for him, we could not get him the care that he needed. And it was really mortifying and devastating to not be able to help our own child. And about the most that we could do was advocate for his needs, and I could bake him snickerdoodles. Now, you might roll your eyes and think, oh, isn't that sweet? She baked him his favorite cookie. But actually, he's hardly had any of these himself since he's gotten sick. Instead, what they're about is as he would be in a psychosis, he would be very self-centered, right? I'm a god, I'm a higher being. But a sign for us that he would be coming out of psychosis is when he would start looking around and recognize the suffering of all of his fellow patients in these psychiatric units and start asking me to bring batches of cookies because he wanted to give them something to enjoy, even if just for a moment. Now, gradually through NAMI, but much more so getting connected with SMI advocates across the country, I have become an activist. And the first time somebody called me that, I really pushed back on it because, there's a negative connotation to that word. But when I read this definition, I recognized myself in it. I have simply, just like all of you, witnessed way too much unmitigated, unnecessary suffering. And I'm forever changed. I can hardly think about doing anything else other than working to make it better for the next kid that gets sick, right? And so I'm thrilled to get a chance to talk with you all because if I can get a few more voices in the work, it's all worth this time.